Thank you, Chairman. Good morning, ladies and gentlemen. I'm Dr. Ying from Department of Laser Medicine, Chinese 301 General Hospital. I'm also in charge of the Chinese Society of Laser Medicine and being the editor-in-chief of Chinese Journal of Laser Surgery and Medicine. You may not know that China had its domestic first laser in 1961, only 10 months after the first laser in the world. And in 1965, China began to use laser in medicine. And our first clinical report of retinal laser coagulation was published in 1971. And then in 1970s, our domestic CO2 laser, neodymium YAG laser, argon laser, helium neon laser, and so on, were used clinically in the countries. And our Laser Medicine Society of Chinese Medical Association was established in 1992. And our national specialized publication is Chinese Journal of Laser Surgery and Medicine. And the PDT in China was started in 1980, and our first clinical patient, cancer patient, were treated successfully in 1981. And in 1991, we developed a new PDT protocols for port wine stain treatment. And this was the very beginning for PDT to treat benign lesions. And this year, our new photosensitizer, especially for vascular PDT, has just finished its clinical trial. And the other two new photosensitizers for PDT treat cancers are in the clinical trial. And now in China, almost all the city and the county hospitals have laser equipment. And over 100 clinical indications are treated by lasers. And laser medicine, as a new clinical department in the hospital, has our national professional operating standard and guide. And now more than 100 medical laser manufacturers in China, and with 300 million RMB sale each year. And this only takes 20%, around 20% market of our yearly laser equipment needs. And now in China, laser is mainly used for treatment in the hospitals, and it can be classified into these three main therapies. And for high-level laser therapy, it's widely used for laser surgery, endoscopic laser treatment, and intervenient uses. And in 1988, we developed laser lithotripsy through endoscope to treat gastric vessels. And for low-level laser therapy is the most common laser treatment in China, especially in the small hospitals and the families. And in 1975, China developed laser acupuncture treatment to treat various diseases. And the photodynamic therapy is more and more used not only for cancer treatment, but for benign lesions. Since 1991, the vascular target PDT was developed in China. And from here, you can see that besides port wine stain treatment by PDT, there are some more vascular lesions can be treated by PDT, like age, the macular degeneration, and esophageal varices. And infectious disease like condyloma and acne now have become PDT new indications. And some more PDT indications are developing. Now let's see how vascular target PDT to treat port wine stain without any scar. And as you know, that port wine stain is a congenital capillary malformation of the skin. In China, we have more than 6 million patients. Until there are none of the treatment can be get rid of the skin lesion color without any scar. Even for pulsed laser treatment, can only treat less than 10% of our patients with satisfied result. That's why in 1990, I designed the vascular target PDT through the photosensitizer uses and the laser wavelength selections to make the photodynamic reaction only happened in the capillary network, and while the around normal structures without any damage. And our study in vitro showed that HMME is a new photosensitizer we developed, can be rapidly and well uptaken by the human endothelial cells. And the study in vivo demonstrate that animal model of port wine stain chicken comb can respond to the vascular target PDT very well. And you can see that chicken comb color faded without any scar. And the microscope that chicken comb showed a lot dilated capillary network vessel net lined with flat endothelial cells, very similar to human port wine stain. And after the PDT, the endothelial cells swelled, then intravascular microthrombi were observed. A week later, the dilated capillaries net disappeared, while the around structures remained normal. An electronic endoscopy showed the endothelial cells necrosed, while the epidermis basal cells and the basal lamina remained normal and complete. And here shows how microvessels respond to the vascular target PDT. And these are the right mesenteric, arterial, and venule, the normal blood flow. And 2 minutes after PDT, the both vessel luminal sizes looked smaller, and the blood flow slowed down. And 4 minutes PDT, and the blood flow in venule stopped. By 8 minutes PDT, the both vessels blood flows stopped. And this is a 13-year-old girl with port wine stain. After one treatment, the lesion color disappeared. And here is her skin blood perfusion measured by laser Doppler. And this is the port wine stain area before PDT. And this one is the normal skin. You can see the blood flow is much higher than normal skin. And during the PDT, the first 20 minutes of PDT, the blood perfusion increased. Then then kept decreasing till the end of the treatment. And 1 year later, the blood perfusion of the skin is similar to the normal skin. And the clinical reaction corresponded with the blood perfusion of the skin. And let's see some more results. And this is excellent after one PDT. And very good response after one PDT. And you can see very clear boundary between treated area and non-treated area. And even for the adult patient can get very good result without any skin scar. And most of the patients need more than one treatment to get excellent result. And even for the damaged skin, PDT still can get rid of the lesion color without adding more skin damage. And we did research to compare the pulsed laser treatment and the PDT treatment for port wine stain. And you can see that by pulsed laser treatment, the epidermis layer can absorb quite some laser energies, while the vessels underneath absorbed more. And for PDT treatment, you can see that PDT reactions happened exactly around vessel walls. In another word, that PDT have much better selective actions than pulsed laser treatment for port wine stain. And now, more basic research on PDT are undergoing in China, such as intracellular localization of new photosensitizers and the cells apoptosis induced by PDT, and the development of new laser diagnostic and monitoring technologies. And in summary, the new photosensitizers and the new laser equipment development have strongly motivated clinical applications. And the achievement of basic research have great contribution to the new clinical indications and new protocols. Of course, there are more work need to be done, not only in PDT, but also in all the fields of laser medicine. So we are looking forward to more international cooperative studies. On the behalf of the Chinese Society of Laser Medicine, I warmly welcome you to China, to Beijing, to our hospital, and to my Department of Laser Medicine. Thank you very much for your attention.